Hi, I'm Nicole Emmitt, and I am one of the dual doctoral students in the CMB program. I'm going to talk to you about opiate use disorder and traumatic brain injury. The risk of developing an opiate use disorder increases by 2 to 6 times with mild traumatic brain injury. And this is especially true of our most vulnerable populations, including adolescents and soldiers. You can imagine that if you are in a contact sport or deployed to a war zone, not only is your risk of injury increased, but also the frequency of those injuries can be increased as well. And so you really want to address what the relationship is between these two and help to address this increased risk that we're seeing. Now, when we talk about traumatic brain injury, we have 2.87 million people who are reported to be treated for traumatic brain injury in the US each year. And these individuals will go to the hospital, they'll go through ER, and sadly, some of them do pass away. However, when we talk about mild traumatic brain injury, it's actually 69 to 90% of all injuries that happen, and it's often unreported. This is usually because if you're in a contact sport, if you hit your head really hard on the cabinet, you might have a headache and you might take aspirin, but you're not necessarily going to go to a doctor and seek treatment for it. And so there's a huge population who's at risk here. The inflammation that happens with mild TBI can actually persist long term. We have a mouse model that shows how neutrophils and macrophages invade the injured brain in response to damage and decrease over the next few days. And so by 7 days past injury, we really don't see that infiltrate. Now, we do see some persistent macrophages that remain in the brain, and these macrophages are showing activation markers on them and pro-inflammatory markers. And so we don't really know what they're doing yet, but we're wondering if this inflammation can be linked to our overall increase in risk for serious disease. Mild traumatic brain injury has been linked to increased risks of Parkinson's disease, Alzheimer's disease, depression, and addiction in humans. And so it definitely has these long-term side effects that are going to be affecting individuals long periods after they've had their injury. Now, the CVM was gracious enough to go ahead and give me a grant to study the interaction of opiates and TBI. And so we started with a condition-place preference model where one chamber will be paired with saline and the other chamber will be paired with morphine. And at the end of testing, we asked the mice which side they preferred to be on. Animals that had traumatic brain injury preferred the side that was paired with morphine more than those, much more than the sham animals did who only had a craniotomy. And they preferred that both at 1 and 2 weeks after dosage, and it really was to a low dose of morphine, actually lower than the clinical dose, which means that they're still feeling a rewarding effect even though we're lowering that dose below clinical effective levels. Now, when we look at the brain and we look at macrophages, we do see a pro-inflammatory response here. Those persistent macrophages within the brain are actually showing higher levels of inflammatory markers like CD86 and lower levels of anti-inflammatory markers. And so that CD86, CD206 ratio is much higher in those animals who have traumatic brain injury along with an opiate exposure. Now, we have a lot to learn about what this means, but we're hoping that treating traumatic brain injury could decrease the risk of opiate use disorder. And so we're hoping to modulate the macrophage response after traumatic brain injury to alter its chronic activation profile and hopefully lower that risk of opiate use disorder. I want to go ahead and thank all of these people. I can't thank you all individually right now, but Drs. Truran and Lowe are my advisors, so feel free to reach out to us. Thank you so much for your attention. Thank you.